I'm Laura, and this is my husband.
I'm Kevin Koenig.
Originally, we both were experiencing extreme knee pain, and it really just, we were looking for solutions. I really struggled with my day-to-day activities. Working was hard. I have a very physical job, and that really played into it as well.
For me, I slipped on the ice. So I slipped on the ice and hurt my knee, and then they had just built this place here in Pewaukee. So it's like, I'll go stop by there, and I walked in, and they helped me through that. And then the x-ray showed that I was bone on bone. So, I was a candidate for replacement. We did shots for a while, and then pulled a pin.
Well, we both did cortisone shots pretty regularly. It was like on the calendar because they didn't, initially they worked and then they stopped working, and they would last maybe a few weeks. And, the first couple of weeks after the cortisone shots, you're feeling like, woo, this is great. I'm back in my 20s again. And then it's just like you fell off a cliff.
So I did mine first. It was, it's kind of funny because I knew I had something in there that was moving around. So there was a chip in there. And he said my right knee was worse. I said, let's do the left knee first because there's something in there that moves. And I don't want to have to, favor it. And he did that. He saved the piece. He found the piece. He took a picture and he sent it to me. So it was kind of funny. He was like, "You're right. There was a piece in there floating around."
I saw him change dramatically within 24 to 36 hours. I was absolutely blown away. And that's kind of when we made the decision, let's just get them all done. We're going to turn our house into this orthopedic wing, basically, with all the equipment that we're going to borrow from friends, family, buy, whatever. I did mine about 2 months later, and then we went on a vacation and came back, and then Kevin did his second, and then 5 weeks later, I did mine. So in about, nine months, not even, we got both of them done, and all the equipment's left the building, and we can move on with our lives. The decision was made. We were both moving forward with this, and we had nothing but our future ahead of us. And Dr. Kelly just walked us through everything. I felt like his staff, and we did PT here too, and everything was just gold star standard. He has such integrity and compassion for his patients. I really feel like he understands how this is for patients, and that really made sure that we were taking care of ourselves. Really, he was very concerned about that.
From the pre-training to all the nurses, and everyone was wonderful to work with.
Yeah. My knee doesn't give out when I walk. That was a scary thing.
It doesn't hurt when you stand up.
It doesn't hurt when you stand up.
When you dry your legs from getting out of the shower. Right, you can do it without your knees hurting. Look at the scars; you can't even see them.
Yeah, our little knees.
Right, and they're straight. I used to be like that. I get my annual physical in December, and I know I'm going to be taller.
Yes.
Might only be a half inch, but I'm going to be taller.